Hi, it's me again, Gary Humble, just everyday American, just like you, keeping an eye on what we're looking at with these COVID numbers. And if you've seen my first video, I'd like to bring you an update because I didn't expect to do another video this soon, but something really, really important happened yesterday with the CDC. They released a new website, or a new web page, I should say, with what they call provisional death counts for the coronavirus disease. And it is a substantial change from what we're seeing on the John Hopkins dashboard, with reports coming in from the World Health Organization and all those sorts of things. Very, very different data. So let's just take a look. First of all, let's just take a look at the data from today and see where we are with the mortality rate. So as of today, on our standard dashboard, we can see that we've got now 1,115,847 confirmed cases of COVID, just over 65,000 deaths. And if we plug that in to our spreadsheet that I showed you on my first video, all things considered equal, that puts our mortality rate today with COVID at 0.2139. So well within the range that we talked about from the Stanford study. But here's what's changed. So let's go look at the CDC website. So here's the cdc.gov, and it's their webpage called Provisional Death Counts for Coronavirus Disease. And let's go take a look at what they show us here. First of all, what is a provisional death count? Let's go down here and they'll tell us what it is. So according to the CDC, the provisional death counts deliver their most comprehensive picture of lives lost to COVID-19 because the estimates are based on actual death certificates than just the data being reported by the WHO and other organizations, and simply how the data is collected. They're also clear that provisional death counts are different from other sources such as media reports because of how they're calculating these numbers. So let's go up and look at this chart. This is the provisional death count by week from the CDC. And so far, folks, this is an important number. The last week they recorded this data was the week ending April 25th, so roughly a week ago from the time I'm recording this video. And per the CDC, they're saying that strictly COVID-19 deaths, when you look at death certificates that are strictly because of COVID-19, that death rate is not over 60,000. It is 37,308. Now look over here, you can see the problem where the data gets messy with the dashboard that we've been looking at is those are deaths with pneumonia and COVID. We have deaths that are mixed in pneumonia, flu, and COVID. So it's important, if you want to know just the impact of COVID-19, the CDC is showing us that death certificate data. Now look at this too before we move on. You could see that the deaths being reported that are strictly due to COVID spiked, or I should say peaked, in the data week ending 4/11, April 11th. You can see that was 12,262. The very next week, the number of deaths reported due to COVID-19 decreased by 15%. That 10,000 number here. And then last week, that number dropped another 69% to 3,271. And so right now, our death toll stands at 37,308, according to the CDC, just COVID-19 deaths. Now let's go back to our spreadsheet and let's make some adjustments to see where that lands the mortality rate, okay? So we've already adjusted for today's typical data that everyone else is using. Of course, see this highlighted number, this number of illnesses takes us to 0.21. Now, I've gotten some flack about that number because people are saying, well, you're not accounting for social distancing. Okay, well, my pushback to that is, number one, in studies done between Norway and Sweden, Sweden is not doing any social distancing whatsoever. What's showing up in the data is that it's having some effect, but not near to the degree that it was thought that it should. Also, people have done, there's all sorts of rallies going on right now in the state of Michigan because their governor is straight up insane. And, Michigan is a state that's pretty serious about being in lockdown. But if you compare Michigan to other states in the U.S., again, we're not seeing that those strict lockdowns are having a great deal of impact on the number of deaths and the number of cases coming out. But let's just say that social distancing and lockdowns are amazing. And we've just done an incredible job here in the U.S. cutting the rate of infection, the rate of illness, even though since you catch it the same way and COVID is supposed to be much more contagious, it would be natural to assume that many more people would have COVID than would typically have the flu. So whereas the flu typically, impacts 8.7% of our general population, and I've estimated that COVID's impacted 9.25% so far, according to positivity rates, which seems to be reasonable, being that it's more contagious. But let's just say social distancing has had an incredible impact, and only half of the people that typically get the flu got COVID, which means our percentage of population illness, let's cut that in half and take that to 4.35, which means roughly over only 14 million people across the United States would have had COVID, which seems kind of a crazy number when we already know that 1.1 million have tested positive. A small percentage of the population has even been tested. So it would stand to reason that number is much higher than that. But let's just say that only 14 million people have had COVID in the U.S. And, right now we have just over 65,000 deaths. That brings our mortality rate to 0.45. Even with that estimate, that is still less than 0.5% mortality. Okay, that's only 2.5 times more fatal than the flu versus the 14 times that we were initially told by the World Health Organization. And then in March, the 44 times more fatal than the flu that we were told by the World Health Organization, which caused us to completely lock and shut everything down. But what the data is showing right now, that on the high side, still less than 0.5%. Okay, but let's go back to our 9% rate of illness, and let's plug in the CDC number. Let's plug in 37,306 deaths according to death certificates. That takes our mortality rate to 0.12%, virtually exactly the same as the flu. But let's account for social distancing. Let's half that percentage to 4.35, back down to 14 million people. That puts a mortality rate at 0.26. So here's what in this little exercise with new COVID data from the CDC, here's what we've learned, that we have a new mortality range, okay, of 0.12%, essentially the flu, to at worst, at absolute worst, 0.45%, according to the data today. Now, if you take that data, some people clowned me for my use of the word extrapolate. Yes, I do like to use the word extrapolate. I think it's a very fancy word. But if we extrapolate that data, okay, and on the high side, the difference of people that would have typically died from a flu season this year compared to the people lost in COVID on the high side, as it turns out, is roughly an additional 25,000 people. Now let's look here at the difference of deaths from season to season just in the flu. Just between 2017, 18, and then 18 and 19 seasons, there was a difference of 27,000 deaths. So just the flu by itself fluctuates to that magnitude from season to season. And at worst, so far from what we're seeing, the data, At most, we've had an additional impact of 25,000 people. We've had a really bad flu season. I just wanted to get and look, go back to this page and keep track of this CDC provincial death count, because that's a really, really important number. Again, currently the CDC per death certificates is reporting a true COVID death number of 37,308, not the over 65,000 that you're going to hear tonight on the news. Again, I hope this is helpful. I think what the data is showing is that we've had an extreme overreaction to this situation. We've destroyed our economy for nothing. We've put people out of work for nothing. We have very desperate people right now in lines for food. We're seeing increased suicide rates. And for what? For what? For a difference of 25,000 people. Now that matters, and it's tragic, but the truth is that we are biological organisms, and we succumb to bacterial infections and viruses and all sorts of sicknesses. And those fluctuations happen every single year, according to the health of our population and according to how old we are. People with diabetes, people with pre-existing conditions that might make you more prone to even death from the flu. As tragic as that is, even a death rate of less than 0.5% is not enough to do what we've done. And I hope at some point that someone is held accountable.